Now, the other thing is we're going to go over today, and I've got some questions for you, Kat, because these are things that many of the members and many of my family caregivers, my family members have asked me in the past when I was taking care of their senior. So first of all, before we get into any of these behaviors, I want to ask you, I've got to put on these glasses for a minute, what are the basic things that our members should do when they see odd or different or difficult behavior? What are some basic things?
Okay, I like to tell anybody, and it doesn't, whoever you're caregiving for, it doesn't matter if they have dementia, if they don't have dementia, whoever you're caregiving for, do the best you can to understand their illness and their disease and how it affects their body and their brain. Brain is different than the mind. Brain is the physical part of your body that is being damaged with dementia or by illness. Same thing with your body. So if your loved one and you know has really bad rheumatoid arthritis, you know that they're dealing with pain on a regular basis. So when something comes up and you're not maybe understanding or they're not communicating, maybe think of that pain. And if that could somehow be interacting or having an influence on how they're behaving, or maybe some type of medication, maybe it's their pain medication. Maybe they need a little more of it, maybe they need less. So just want to bring that to your attention first. And also, since so many of you, I mean, I only know of 2 members who are caregiving for people who don't have dementia. The rest of you are. And I do want to explain, being a certified dementia practitioner, I think it's important for you to know, if you don't already, what that dementia is simply a word, the mothership, that means memory and cognitive impairment. And under the word dementia comes all the other different types of dementia: Alzheimer's, Lewy body, perhaps dementia caused by an accident, which could possibly reverse itself, maybe not. But
and vascular,
right,
frontal lobe, all of
exactly. And the thing is that, yes, dementia, regardless of which one, does cause memory and cognitive impairment, but depending on the type of diagnosis of dementia, what is happening and causing that damage is different. And that's important to know because it could affect the medications and affect how you react to them. Sometimes the way that you react to somebody with Alzheimer's compared to Lewy body can be very different because of the way that the disease works on their brain and what causes it. The last thing, I want to just give an example to kind of push this forward and how important it is to understand what physically is going on with your loved one regarding their illness or disease. Your brain tells you, I'm thirsty. If that part of your brain's not working, you'll never be thirsty. And that could be one of the reasons why your loved one won't drink water. They're just not thirsty. They don't know that they're even thirsty because their brain has shut that part of the communication off. Also, if someone's thirsty, they need to be able to recognize that by picking up a glass of water, they will quench their thirst. That's cognitiveness. If that's impaired, they can be thirsty and wanting that water so bad, but not knowing how to pick it up. And then the last thing I want to let you know is that to pick up that glass of water, all of this has to go on, the feeling of being thirsty, the cognitive awareness, but then that thought to pick up that glass has to go from your brain all the way to the end of your hand, back to your brain. All this happens in a nanosecond. Is that amazing what our bodies do? But if any of that any of these signals are interrupted, that person's going to have a hard time picking up that glass of water and drinking it. So please keep that in mind when you are when you're dealing with your loved one that has a type of dementia. And I suggest, you know what's best, but I do suggest anybody who has a loved one with dementia that you take them to a neurologist and get them diagnosed for the specific
Correct.
type of dementia. And there's a lot of medications that can help them, may not make it go away, but can help them live a better life and be happier. So that's for everybody to keep in mind. I'd like for them to know. Also, when it comes to behaviors, we're going to work on finding the root of the problem. You know what's going on physically, but there's also then a mental root to the problem. It depends on perhaps the history of the person. And we'll get into that and how you can help get to the root of these problems so you can have better control over the situation and keep your loved one from having a meltdown. I know that most of you are probably, I need to keep my husband busy. I need to keep grandma busy because I have to do the dishes. But the truth of the matter is really that they need to be occupied so they don't get into a bad behavior. When I was working in memory care for the last 15 years, a saying amongst the staff is, a bored resident is an unhappy resident. And that is what happens. If they're bored, then they can get into all these thoughts they normally wouldn't be thinking. All of a sudden they realize they're confused. They don't know where they're at. All of a sudden they're bored and they start acting out. So do keep that in mind as well with activities and keeping them occupied. That, yeah, you may want this break, but the bottom line is really to keep them healthy and from being stressed and anxious and staying away from behaviors that are more difficult to deal with. If you need a break, please consider bringing a friend over or hiring a companion or having somebody stay with your loved one because they need socialness as well. And then that can give you the nice break that you need. And therapeutic lying. I can't tell you what makes you feel comfortable or not. And I can't, tell you that you should lie. All of us were brought up being told lying's bad. And I understand that. But when you are dealing with somebody who has their own reality, think about maybe considering being in their reality. Why is it that maybe when grandma's sister passed away, she's 90 years old, she hasn't talked about her sister in years, you tell her she passed away, what are the chances of maybe her not being able to really understand and then start crying and uncontrollably crying, perhaps saying to you, oh, you're lying, she's really alive? How does that do any good? So I want you just to think about the use of therapeutic lying and how you, by using it, you are perhaps really helping your loved one. Instead of creating anxiousness inside of them, you keep them subdued and calm. So those are the things I just wanted to talk to you first before we get into individual behaviors, because everything I just talked about has to do with how you deal with each and every one of these behaviors. I do talk to a lot of caregivers. Should I tell my mom this? Should I tell my dad that? Whatever. And my mom's 96 years old, and she had two sisters passed away in the last 5 years. She hasn't talked about them in ages. And she's so happy every day. We chose not to tell her. Why make her sad? Mm-hmm. Yeah, there really wasn't any necessity for it. Now, my dad, when he died at 86, my dad was totally with it. He had heart disease, totally with it. And he had a friend, Hank, who had cancer. He knew Hank had cancer. He'd ask us, how's Hank doing? And we told him when Hank passed away. He wanted to know, he should know, he deserved to know. And he then called his wife to give her his condolences. Different situation. So, exactly. The other thing, the other thing too, I forgot to mention that you can do to help deal with some of these behaviors to kind of prevent them from happening or happening so severely is stay on a schedule. keep your loved one on a schedule. They get used to that, and they actually enjoy it. They start to feel, whether they know it or not, that they have control in their life then. So if you can, get a schedule going, exercise. Even if they can't get out of bed, exercise. Please make them move their arms. Put on a great chair yoga station. There's a Facebook page, Yoga for Caregivers. They have yoga for 3 minutes, 2 minutes, 5 minutes, 20 minutes, yoga in bed. And you can even do this with your loved one. And sunlight. Make sure your loved one gets sunlight. And if it's cold because of snowing, sit them by a window for a while. Make sure they get sunlight. You'll find that they could go to bed a bit easier. We'll talk about sundowning in a little bit. And just keep a personal connection with them. Even if they can't talk back, even if you're not sure that they're understanding you, talk to them and keep a personal connection with them. So that's what I have to say to start things off.
Okay. So now we're going to talk about some of the common behaviors.
Yes.
And I'm going to run down this list, and if you could just briefly, mention them. I know you're well familiar with all of them. I know that you could, anybody that calls you, any of our members that want more information, absolutely, the techniques to try. See, as a medical provider, Kat, my job is, yes, I wanted to take care of my seniors, and I realized the only way I could take care of them was to take care of the family member first who was caring for them. If I could get the family member happy, healthy, energized, optimistic, inspired, I knew my senior was going to be much better off. Because remember, most of my senior patients came in and I'd say, "What brings you in today, Mrs. Smith?" Nothing. And, I'd sit down, I'd try sitting next to them, I'd try touching their hand, I'd try sitting on the pull-out part of the exam table, I'd sit lower than them, talk to them, everything. No, some of them would not have it. They just didn't trust me yet. So if I could get the caregiver, the family member, to open up to me, and many of them, they got so good at it, they'd send me notes before the visit. And they'd say, "Hey, mom's really sundowning right now. I mean, we got to do something about it." And, I'd go right into that. Or they'd say something about, "Dad won't stop driving." And I'd address that. Not that I pretending that I never heard it before. I'd go, "Are you still driving? I need you to stop driving. I'm going to take all your medications away if you keep driving." And we'd laugh about it, but I'd say, "Seriously, I want a date. You're going to stop driving." They would listen to me when they wouldn't listen to the family caregiver. So I encourage, when the ads on TV say, "Talk to your doctor," I cringe, because most family members don't know what to talk to the doctor about. And the thing is, the doctor has 10, 15 minutes with you and has no clue what's going on in the home life with all these behaviors. You keep a journal, you write these down, you give them to the doctor before you go in, so the physician or the PA or the nurse practitioner can read them. Then we come in with some ammunition and we can accomplish some things. Okay. So just a thought, but that really helped us if we knew what was going on. So let's talk about repetition and maybe even fixation and shadowing and sundowning.
Okay. Well, repetition is the number one thing on a daily basis. It's like you're at the end of your rope. How many times can mom ask, "When are we going to eat?" How many times can dad ask, "Oh, is so-and-so coming over?" Whatever. First, try not to tell them in advance about too much, because once it gets stuck in their mind, they won't forget. And if you tell them a week in advance that his son, who he never sees, is coming in town from Colorado, you may hear that 20 times a day, 50 times a day for the next week. And telling that person you've already asked doesn't work. Why? Because of what we talked about earlier on, that is physically going on with their brain. Right. They have no idea they're asking you 50 times a day. They have fixated now with that question. It is stuck in their brain. So the repetition, the fixation of that. So the number one, try not to tell them too much far in advance. When it's time to eat and you want to get them ready to eat, and let's just say they usually eat at 6, but at 4, they're bugging you. They want to eat. When do I eat? Maybe plan they eat a little bit less for dinner, because at 4, when they start bugging you, when do we eat? When do we eat? You can give them a little snack or a little nosh, maybe give them their salad, their soup, whatever. And then that will get them to that 6 o'clock time frame.
Well, that goes back to a schedule. If you have them on a schedule, then they know, or they're
right.
hopefully
Right.
got an idea. I have this activity, and then we eat.
Right. And try and figure out what's going on with the repetition and the fixation. If you can get to the root. I mentioned this a little earlier. I'll give you an example. Mom loves Panera. She always gets the chicken salad sandwich and a cinnamon roll and a cup of coffee. So she can only eat half of her chicken sandwich because she eats all the cinnamon roll. Well, the last time we did that, she kept asking my sister, oh, would you like some of my sandwich? My brother, would you like some of my sandwich? Me. Finally, my sister, bless her little heart, goes, Mom, quit asking. Nobody wants your food. So Mom's like, I thought she was going to cry. So I said, a light bulb went off. Mom, would you like a to-go bag? Oh, what a good idea. Now, of course, that's not the first time she ever heard of a to-go bag, but in that case, that was like the first time she heard about a to-go bag. So I brought a to-go bag back, packed everything in there, put the to-go bag on the seat where she could not see it, took her plate away where she could not remember that she didn't finish eating or whatever. Her fixation went away. We were able to have a conversation. So when it comes to somebody being stuck on something, whether it be repetition or a fixation on something, see if you can get to the root. So perhaps you can turn it around. One more example would be at a memory care community I worked at. We had a gentleman, he'd go around and knock on everyone's doors. And, it was really disturbing to everybody, right? So we found out he was a mailman and he wanted to deliver mail. So we gave him magazines and envelopes and stuff. So instead of knocking on the doors, he started putting these items outside of the doors. Then we would collect them up, give it back to him. He was so happy because he was working. Every once in a while, he'd even say, I have to go to work. So getting to the root, finding someone's history, things like that can really help with the fixation. As far as the repetition goes, see if you can do something to calm them. Sometimes with the repetition, they can get really riled up because when do we eat? When do we eat? When is Robbie coming? And you don't want it to escalate. That's what you really want to do, more than you want to stop it, but really what you need to do is not let it escalate. So instead of saying you already asked me, or say Robbie's not coming till next week, try to see if you can talk about something else. Like, yeah, yes, you're right. You're right. Robbie's coming. Don't you just love Robbie's dog, that German Shepherd named Lucy? You see, get onto a different subject and then see if you can get them engrossed into an activity. They may ask you in another half hour, when's Robbie coming? But at least they had some calmness for a half hour or so.
The thing is, with somebody who doesn't have dementia, you would think, okay, they're worried about that one thing. They're worried about maybe not eating or getting their next meal, whatever, if they keep asking when we're going to eat. But correct me if I'm wrong here, Kat, but I would say that with dementia, as the neurons are breaking down in the brain, that isn't necessarily the case. It's just dementia. It doesn't mean that they're worried about the next meal. It means they're just going to keep asking. Am I wrong on that, or is that?
You are absolutely right. However, it is very possible that somebody is reverting back to the depression. Like my mom fixated about wasting food. She did not want to waste the food. Does that go back to depression time? I don't know. I usually don't take a to-go bag home. I see less and less of my friends do that too, but very calm with older people. So you're
Well, with hoarding is a lot of going back to the Depression and World War II. When they were raised, these were their formative years. And as I've said, these seniors were raised, leave me be, let it go. We don't have much. How dare I ask?
And that's where hoarding and rummaging come in. Rummaging and hoarding kind of come together. And a lot of times it's because they're fixated about something that they think they may misplace that they're going to need. I worked at a community where a lady was obsessed with toilet paper. She would put a little hat on. She'd have her bag in her hand, and she'd say, "Get me a taxi. I have to go to the store." So instead of saying, "Well, you can't go to the store because you can't. We don't allow you to go to the store," it's like, "Well, what do you need at the store, Phyllis?" "I need toilet paper." "Oh my goodness. Well, I think you may have some. Let's just go look." We go in a room. We always had toilet paper. Always made sure we had toilet paper, a few of them in her closet. She's like, "Oh, you're right. I guess I don't need any after all." Isn't that great? Because now you can sing songs. We're going to be playing some Bible music in about 5 minutes. Let's get ready for that. See, maybe in the afternoon, she's going to want more toilet paper, and we're going to have to go through the same thing. But isn't that better than saying, "I can't call you a taxi. You have no business going to the store"? So when it comes to hoarding and rummaging, it could be, for instance, rummaging can be because the person is really anxious and they're scared and they're confused. Can you imagine waking up every day and not knowing where you are?
So what's rummaging?
Yes.
Is rummaging going through stuff?
Oh, yes. They'll go through all your drawer. They'll go through your drawers and rummage and take stuff out. They'll go through your cabinets and take stuff out of the cabinets, take stuff out of the fridge. And it's a reaction in most cases because they're fidgety. They need something to do with their hands. So if you can keep them busy, preoccupied with something else with their hands, sometimes that can help. Yes, sometimes you have to revert to locking the refrigerator and locking your doors and your drawers. But even if you do that, that person may come up to those cabinets and start shaking them and then really have a meltdown because they cannot open them. So you still haven't solved the problem for them. You've just you solved one for you, but you created a bigger one for them because now they are really having a meltdown. So you need to give them something. Maybe you have an extra room in your house. That could be their hoarding and rummage place. Have drawers in there with stuff in it for them. Maybe they like balls or rubber bands, whatever it may be. And they can rummage all day long, give them marbles.
The new thing is that spinner. And I've seen that work well with seniors. Of course, it works with children, grandchildren. They spin, they sit there. It's a circle thing with little legs like on it and just spin that thing all day long.
Right.
Amazing. Or the poppers.
Right. Doing something with their hands, someone that rummages, is soothing them. So give them something soothing. So for the rummaging, that's what an idea they have for the rummage. Have a rummage box and have all kinds of things that feel different in that rummage box. It could be crayons and paper, fuzzy things, just all sorts of different stuff, and let them rummage all day long. And then the same thing with hoarding. It could be that somebody's fixated on soup, so they want to hoard soup. Okay, well, if it's not hurting them, let them hoard a little bit then. Okay, let them hoard what they want in their rummage and hoarding room or little space. It's okay if it's not hurting them. Yeah, you don't have to feel that everything that is annoying to you or everything that's kind of not looked upon as normal is really bad for them and that you always have to change it. Be open to what's really going on. Is it you being annoyed, or is this something that's actually giving them some comfort? So what the heck, let them go ahead and do it. So the rummaging, yeah.
Go ahead, sorry.
So the rummaging and the hoarding, you know, what they like to rummage and hoard through could have something to do with old memories or whatever, but most of it is with the rummaging. They're nervous. They need something to do with their hands that makes them calm, and the hoarding makes them feel secure. They're hoarding something because for whatever reason, it's making them feel secure. They're afraid they're going to run out. They think they're going to need it later, you know, so why not go ahead and let them do that as long as they're still safe.
Even a nice stuffed animal or a scarf, something. I want to go back to earlier behavior. You were talking about, you know, the fixation and the repetition, but what about sundowning? How do our members handle sundowning?
Yep. To me, shadowing and sundowning,
Okay.
I don't know, they kind of go together. So everybody has a biological clock that you wake up to and you go to bed to, okay? And even normal people who don't have dementia, how many of us have a problem getting up or going to sleep? So even a person who doesn't have dementia has issues waking up and sleeping. How about someone with dementia? That biological clock is all messed up. It's just not working right. So what happens is they're up all night. This can happen. So, and then you're up all night and you're tired the next day. It's not good for you. In a memory care situation, if somebody sundowns, there's always somebody there. There's always a caretaker. So if somebody's sundowning, and usually there's more than one person, that caretaker will play cards with them, make them a meal, watch videos with them, take them for walks inside the community, things like that. But you can't really do that because you need your sleep. Maybe you're working a job during the day. So number one, keep in mind, it's the biological clock that's messed up. So just a few little things that you know, you could try is talk to the doctor and see if there's some sort of medication that could help them sleep. That would be the first thing that I would do. Ask the doctor if melatonin, if he doesn't mind, if she or he doesn't mind, if you give them some melatonin. I know some people that take their loved one to bed about 10 to go to the restroom. They give them some melatonin and they sleep all night, and then they wake them up by 6 so that they don't have any accidents in the bed. So they use the bathroom before they have an accident, and that's kind of helped solve things for them. During the day, exercise. Please get your loved one to do some sort of exercise and get them in the sun. That could help as well. And then when it gets time, well before it's time to go to bed, if you want your loved one in bed by, let's say 9 or 10, about 5 or so, shut the drapes, shut the lights, create a very calm setting. You may want to turn off the TV, just put on some really nice music while you have dinner. Have it be calm so that when it's time to go to bed, they're already calmed and a little bit sedated, and see if that can help with the sundowning.
Those are excellent ideas, and I thank you for that. You mentioned vitamin D, and you've mentioned it a couple of times. It is one thing in medicine we never, ever stop checking in seniors. Seniors have got to have vitamin D. Most of us in the medical field will tell you that we believe vitamin D was misnamed, that it should have never been a vitamin. It acts more like a hormone, to be honest with you. It does so many things and taps into so many different chemical reactions within the body that we always want our people on vitamin D. Now, vitamin D can be toxic if you take too much of it. So we want to make sure B and C is fine because that's peed out by the urine, that doesn't build up. But A and D are two vitamins that can be toxic because they're stored in the fat cells. So you want to be careful, but we will always check vitamin D. And the other thing I will share with the members, just from a medical point of view, there's a huge range on the lab score of what vitamin D can be. There is always a range on any lab. But what you want to look at is you want to look at where their vitamin D level was the last time compared to now. You want to make sure it's not, low normal. They say, the doctor will say, oh, it's normal. Well, wait a minute. Is it still the same number it was before? That was one of my things in medicine. I always wanted to make sure that what was normal 10 years ago, that number, like for thyroid especially, was still the same today, if that makes sense.
Yes.
So anyway, sorry to go off on that, but vitamin D is critical. I totally agree. And as far as medications to sleep, we have tons of medications which also have side effects that cause sleepiness that we can try. And oftentimes I would start a patient on an appropriate drug off label, right, to get them to sleep. It might work for a couple of months, then it wouldn't work anymore. So we'd switch to another one. That would work for a couple of months. Then that one wouldn't work anymore. We might go back to the first one. And I had to explain to my family members that just because it stopped working doesn't mean it always stops working. You would be shocked at how many times a medication doesn't work. We do a rest on it, we put them back on it, and it works beautifully. So if your doctor ever says, let's try it again, go for it.
Yes.
You just never know.
Right. And that's because with these illnesses and diseases, especially with dementia-related ones, they never go away. They just continue to progress. And that's why, as a caregiver, it makes it so difficult as well, because it's as soon as you maybe find a solution for one thing, all of a sudden another thing pops up, and then the other solution, it doesn't work anymore, and they're worse than they were before. So, and it's just unfortunately how it is. But the more flexible you are, the more maybe realistic about things you are, and the more you take care of yourself, it will make it a bit easier for you, and you will feel more in control. I think that the number one cause of anxiousness and stress is the feeling of out of control. If you feel you're more in control of the situation, that will help you tremendously. And being in control of a situation means that you have a better understanding of it. That always helps, and that's
It does.
what today is all about. Yeah. Mm-hmm.
I was going to say, if you can just breathe through it. And a lot of things, like we'll talk about what to do when people won't take medications, when seniors won't take medications. But, with Aricept and Namenda, one of the things you have to understand is when the senior first starts taking it, we see how well it works. But because the disease is progressive and the disease keeps getting worse, we can increase the medication, but only so much.
Mm-hmm.
After that, we can't increase it anymore if we hit the maximum. But then the disease is going to continue on.
Mm-hmm.
So whether the doctor keeps them on it, the disease has taken over, or whether they choose just to take them off because it's not working anymore. Understand that it's only going to work until the disease becomes so bad it won't work.
Right, right. Now, about the shadowing,
Yes.
think if you woke up every morning not knowing where you were, and you were scared until you saw someone you recognized, and that person's you, the caregiver, and that's the only time you felt comfortable. That's what's happening with somebody who's shadowing you, in more than likely. They feel comfortable seeing you. They want to see you. They may be afraid you may leave them and never come back. Maybe they're, whatever it is, you're their comfort and they really need you. And you're not going to change that feeling. But what you can do is help them through it and help yourself get on with the things you need to do, which is difficult when somebody's right behind your back all the time. So number one, have something ready for them to do, whatever room you're in. So when they follow you to the laundry room, they have their little basket of things they're going to fold for you. Say, so while you're doing the laundry, Frank can fold the clothes, do whatever. If you're in the kitchen, have them have their own, if you're afraid they're going to drop something, they can have their own durable knives and forks, plates, cups. Ask them to set the table, ask them to fold the napkins. And so give them something to do to help you. Say, I need you to help me. And that way they'll stay out of your hair, hopefully long enough for you to get done, make dinner, do what you, but they're occupied and they're not stressed. That fear, they're not fearful. So that's the main thing that I have to say about shadowing. The other thing too is there's something about marbles, something about buttons and money. People tend to love to take money and put coins in different tins or different, what do you call them? Tupperware things. They love to do that. They love to separate marbles. That could be, once they're really into doing that, you may be able to leave without them really knowing you're gone for at least long enough to maybe go to the restroom or, change the washer and dryer, whatever. So see what those kind of things may work with them. Some people do well watching exercise on TV, and they get engrossed with that. Sometimes that can help as well. So, and as far as taking medications, yeah, I don't need to take that. I'm not sick. There's nothing wrong with me, and, or they just don't like taking pills. There could be all kinds of reasons behind it. But one of the things you can do is you can turn it around and say something like, oh, you asked for your medications, here they are. Depending on the stage of dementia, your loved one may not even know if they asked or didn't ask. And there you go. They're going to take them because you told them they asked for their medications. Just like eating, your loved one won't eat, because they just decide they don't like spaghetti, but they eat spaghetti. They love it. They grew up on it. They're Italian. I made your spaghetti you asked for. There you go. That with medication, something like that may work. The other thing too is ask your doctor what medications you can crush, add to liquids, add to pudding, ice cream. That's the easiest fix.
And which ones can go with which ones, because there's a lot of medications, including vitamins and minerals. You cannot mix them.
You have to
vitamins
ask.
will stop the absorption.
Yes.
And then they come back in the office and say the medication isn't working. And when I start asking, wait a minute, what other meds are you taking with it? When do you take it? Do you take vitamins and minerals at the same time? Not going to work, especially those sleeping medications.
Yeah.
And those take time to ramp up.
Mm-hmm.
So it's not an immediate, unless I give certain other drugs, but usually it takes time.
Yeah. And we had one senior, they loved, cookie dough. And so the smaller pills.
Who doesn't?
Little cookie dough. But do ask the doctor. And Suzanne is absolutely right. Do ask the doctor and see if possibly that could work. But sometimes it's just a control thing. So let them be in control. It's okay.
The other thing about medications, it reminds me of the food too. Sometimes they don't want to eat. And like that Ensure, the doctor ordered that Ensure for my mom. And I asked the doctor, I said, have you ever tasted that stuff? And he said, no. And I said, I'm going to send you a bottle.
Yeah. My God, I just noticed it's a 1:45 already. Oh my God, I could talk all day. Okay.
I know we could.
Yeah,
we probably should. We should do a couple of times a month, a question and ask and just talk and hey.
Because I love this. Was one of my favorite things to do in memory care is, figure out because each resident's different, but I want to talk about taking a shower and getting dressed, not getting dressed, wearing the same clothes all the time. Okay,
Please
this
do.
is the next, this is the last most common. And then hopefully I have enough time to get into a couple
Okay.
of the most challenging. So showers. You know, a lot of seniors with dementia, they don't like showers because the shower actually hurts them. Their brain is telling them that shower is now painful. So something that used to feel good to them no longer does. And with dementia, sometimes you'll find that people, they just can't communicate. They don't even really understand what they're feeling. They just know they just don't feel good. So, so with the shower, keep in mind that maybe you'll get them in the shower and just do a nice sponge with them. You have the shower going, but not directly on them. Mirrors. A lot of times people think people are in mirrors looking at them. So even though they don't say anything to you about it because they can't communicate it, maybe you want to cover up the mirror. Maybe you want to say, are you ready for your spa? I'm ready to take my spa, I'll do my spa with you. And you have a special little robe or one of those Velcro thing. We got a Velcro thing for my mom. And that really helped a lot because she didn't like, she was a little modest, you know, so she had that little Velcro thing and sooner or later she was taking it off, you know. So use your imagination, you know, with the shower. And sometimes you can say something like, you're going to the doctors and you don't want to go to the doctors not smelling good. My mom loves McDonald's sundaes. We'll take you to get a McDonald's sundae if you take a shower. I know it sounds like you're talking to a kid, but it will work. If we tell her that we're going to take her to a restaurant, we don't have to take her, she'll forget, but at least it gets her in the shower. About dressing. Okay. When they're not, or they won't change. When they're not, first of all, it could be a control thing. Only give them so many choices in their closet. Clear everything out of the closet. Put a pair of slacks, a shirt, pair of socks, underwear on one hanger, and give them 3 hangers to choose from. It makes it easy for them, less confusing. They don't mind making a decision because it's not confusing, and they want to make a decision. They want to decide what to wear. That can really help. Not changing. I know some people, they've talked about their loved ones, they'll sleep in the same clothes, you know, forever. Well, of course, if they're not changing the clothes, the chances are they're not taking a shower either. So first of all, if it's once a week, once every 10 days or whatever, if that's all you can do, just think about, again, going back to what is right for you or what may be okay for them. You know, yes, I take a shower every day. I can't imagine not, sometimes 2. But if I can only get my mom to take a shower once a week because I'm taking her to McDonald's for a Sunday because it doesn't work every day, it's okay. Is it really, how much is that harming that person? When they're not looking, when they're sleeping, get rid of their dirty clothes, replace the clothes with clean ones. If they only want to wear the same thing, I knew a gal who only would wear a pink top, white slacks. That's all her daughter bought her. She had 20 outfits of pink tops and white slacks, but she was happy. So find out the little idiosyncrasies and see if you can help them with that. And I'm sorry I had to go through that so quick, but I want to get to abuse. Caregivers do not put up with abuse. Just because you're a caregiver and you're dealing with a sick person, you do not put up with abuse, even if it's from a sick person that may not know what they're doing. Don't put yourself in harm's way. So when it comes to abuse, number 1, verbal abuse. If your parent was toxic growing up, they're not going to change as an adult, and they're not going to change with their illness usually. A lot of times it gets worse. So please understand that. And it's really hard, and it breaks my heart to see things like that happen to people. And a lot of times you have nothing to do with your parent until all of us years later, they're sick and you are now taking care of them. Maybe you want to make things right because things were never right. Maybe you feel guilty because whatever it is, but you're taking care of them. Don't put up with their abuse. Leave the room if you have to. If they're not harming themselves, walk away. Get out of the room, just walk away. If you are concerned about creating an abusive type atmosphere, maybe your loved one gets riled up easily, when you talk to them, keep your space and don't talk right in front of them. Talk a little bit off to the side. It feels a little less threatening. Always watch your tone of voice. Never raise it. No matter how much they're starting to raise, keep yours low and keep eye contact with your voice low. A lot of times you look at somebody in the eye talking low. It'll calm them down. Mm-hmm. You may not be able to totally stop abusive behavior, but maybe you can keep it toned down enough so that it doesn't accelerate into something really bad. So that's what I have to say about the abusive behavior. If someone's trying to hit you, bite you, spit on you, it may definitely is time to speak to their doctor or speak to perhaps some other type of services or a place for them to live. I am not telling you what to do. I'm only making suggestions because you should not be getting hurt and neither should they. So in the limited amount of time, that's what I have to say about abuse. Swearing. I know a lady whose daughter said, Mom went to church every Sunday. She never swore. All of a sudden she swears. So the best thing you can do about that is look at any triggers. When are they swearing? Is it a certain time of day? Is it when the grandkids are over? Because even though grandkids are cute and loving, maybe they make noise, maybe they're an irritant to them because of just their rambunctious, whatever. Watch when they're swearing. If they do it all the time and it's inappropriate, you may want to consider not taking them out to dinner or to other people's homes. But when people come to visit them, warn them that they have this habit of swearing so that they're not surprised and they can still perhaps spend some time with them. Do the best you can with just ignoring the swearing, but chances are you're really not going to stop it. You won't stop it by telling them to stop. That's for sure. Right. You'll just keep riling yourself all up. Disrobing, okay? Keep in mind when people take their clothes off, it's because mostly they're uncomfortable. They're not reverting back to when they were babies and born naked necessarily. They could be, but more than likely, they're just uncomfortable. The clothes, just like the shower that used to feel so comforting and nice and warm and great to them, this clothes is making them feel itchy. Their brain is telling them you're itchy and uncomfortable. That's why they'll keep trying to take their clothes off. Same thing with the depends. They'll try and take their depends off. They're uncomfortable. So think about adaptive clothing. There are so many great online adaptive clothing options out there. They're a little expensive, but just get a few outfits to start off with.
What do you mean by adaptive?
Oh, okay. Like for instance, the residents that would want to take their pants off, their depends off, jumpsuits are great. And the jumpsuits actually look like a shirt. The shirt, it looks like a shirt with pants because the pants are underneath the shirt that kind of comes out, but it's connected underneath it. So you don't even know it's adaptive clothing. It's not anything at all too embarrassing. That is embarrassing. Some of them even have buttons, but they don't work. But they look like a shirt. It's maybe Velcro in the back, so it's easy for you to take off. Any zippers are in the back. So it's easier for you and they can't take their clothes off. They're going to still fidget because they're uncomfortable. They're going to fidget. Okay. So how about a fidget blanket? Fidget blankets and weighted blankets can do wonders for a person like this. A fidget blanket is a blanket that has maybe something that feels like a big cotton ball. Maybe there's something on it, some big beads. It has all sorts of things on it for them to touch and feel. And if that you put that blanket on them sitting in a chair or whatever, they have something to take their mind off of the fact that they have itchy skin, that they're uncomfortable. So a fidget blanket's great. A weighted blanket is really great as well. It really can help somebody go to sleep. And that will help, I think, with the sundowning and people that don't go to sleep. It actually has a weight in it, and they are, you can go online and research. They have to be a certain weight to work, and that actually comforts the person, puts them to, gives them comfort and has them be calm so they can sleep. So a rummage blanket, a weighted blanket, that helps as well. And the other thing with adaptive clothing is if your loved one doesn't like changing their clothes, a lot of reason could be because it's uncomfortable for them to change clothes. It's a hassle to change clothes. But when you get adaptive clothing, maybe instead of buttons, it's Velcro. And you can have them say, put your arms out. They put their arms out, easy to get on, and you just Velcro it up. Or in the front, put your arms out. How easy is that to slip something on and then Velcro the back? Same things with slacks with that either have side Velcro or they just pull up. A lot of people, they don't want to change because it's a pain in their neck. It's uncomfortable, a pain in the neck. It takes too much time. Make it easy for them, make it fun for them, give them limited choices, let them choose. So all of that can help. And adaptive clothing is great. There's even shoes with Velcro on it. And if you can have a loved one who can slip their feet on their own into their shoe and maybe Velcro it, it's a sense of accomplishment, which also helps with behaviors. It keeps them more content and satisfied. And the very, very last thing, because I have 4 minutes left, is I just want to tell you a story about depends. My mom knows when to go to the restroom and all, but at night she couldn't make it quick enough. So she was constantly having accidents at night and was driving my brother and his wife crazy. They take care of my mom. So on one of my visits, I always sleep with my mom, and she's getting ready for bed and she didn't put her Depends on. And I'm like, Mom, do you know you have accidents at night? She goes, yes, I know. I go, well, that's why these are here. She goes, I'm not wearing a diaper.
Yeah.
I don't blame her. I got it. So I said, well, what if I found something for you that helped you with your accidents, but didn't look like a diaper? She goes, oh, that would be great. So the next day I went and I got some, it's called Poise, P-O-I-S-E. They're little pink, made out of something more like fabric, but in the middle was what she needed to stay dry. They had little butterflies on them. I went home, took out all her underwear, replaced it with that. When it was time to go to bed, I put them on her bed, and she didn't put them on. I'm like, Mom, remember your little accidents? Look what I got. She goes, oh my God, they're so pretty. She still forgets to put them on, but when she's reminded, she will put them on. So got to the root of the problem. That's how I'm going to end the whole thing. Is sometimes it takes a while, but getting to the root of what the problem is in their mind can help with some of these behaviors and getting them to cooperate with you.
That's true, because you can't always, you don't know what's going to work. You just have to try different things, and you're going to click eventually. Something's going to work. And thanks, everybody. Take care.
Bye-bye.
Bye-bye.